Hi, my name is Heather, and I'm here with Portia, and you can look in there so they can see you. Hi, and we are going to do our head-to-toe assessment. Okay, so first we're going to start with the inspection of the skin. I'm going to look at your upper extremities. Make sure these are in the video. Your upper extremities, I'm testing your skin. I'm noting your color is light brown. Your skin is warm. The skin is soft. There are no lesions, no disformities here with your skin. These are your upper extremities. I'm going to look down here at your lower extremities and try to put that there so you can see what I'm doing. So I'm looking at your skin here. The skin tone again matches the top. Hair distribution is normal findings for a female. There are no varices. Again, the temperature, your skin temperature is warm, warm and soft. Okay, so you put that back down. I want to look at your skin here. I want to test your turgor, and that's good, and that's good. Then also no edema on your hands or noted on your feet. The next thing I'm going to do is I'm going to look at your nails. Your nails are clear. There's no opacities, no ridging. Capillary refill is within 3 seconds. We would do this bilaterally with both hands and feet. Your nail beds are intact. If you can go like this with each nail, and they match together, you should see a diamond shape there. Your nail beds are within a 160-degree angle. You do that with all of them. Oh, okay. All right. Very good. All right. So then the next thing that I'm going to look at is I'm going to inspect your head, your face, and your scalp. The first thing I'm doing, I'm looking at your head. It's normal physallic. It's a normal size. It's shaped round, no irregular shapes. Then the next thing I'm going to do is I'm going to look at your scalp. Your scalp looks, let's see if we can get that up. Your scalp looks clean and dry, and I'm just going to feel in there. There's no dandruff, no infestations. Distribution is even. Then the next thing I'm going to do is I'm going to try to palpate there, wiggle that, and your scalp is movable. The next thing I'm going to do is I'm going to palpate your sinuses right here. And do you feel any tenderness? No. All right. And so again, what I'm checking for is any lumps, bumps, or bruises, and I don't see any of that. I don't feel any of that. Any pain in your head or in your face when I did that. No. Next, I'm going to check your TMJ. If you could move your bottom mouth like this. All right. And there's no clicks, no crepitus felt. The next thing I'm going to look at with your is going to be, we're going to go through each one of your senses. We're going to test all of your cranial nerves. We're going to start with cranial nerve number 1. That is your nasal nerve. So I'm going to ask you, and that's olfactory. So I'm going to ask you if you can smell this, and what does that smell like?
It smells like vinegar.
Okay, great. And I'm looking at your nose. Your nose, skin color. Your nose is midline, same color as the rest of your skin. There are only a few maculars noted, and those are freckles, and those are dark brown, and those are scattered amongst your cheek and on top of your nose. I'm going to look inside of your nose with the otoscope here, and what I'm looking for is to make sure that your septum, there are no deviations, and that your mucosa inside is pink and moist and the vegetables are present. All right, now I'm looking in those, and they are. Next, if you can occlude one side and smell, and include the other side and smell. Perfect. All right. The next thing I'm going to look at is your optic nerve, cranial nerve number 2, number 3, and number 4. That is your optic, your oculomotor, your trochlear, and also cranial nerve number 6 is your abducens. So we're going to do this with a variety of different eye exams. The first eye exam that tests your optic acuity is going to be the Snellen's test, and then the Rosenberg test. Now the Snellen's test measures distant acuity. And have you ever had an eye exam?
Yes.
And do you wear glasses?
Yeah.
Okay, and are you nearsighted or farsighted?
Nearsighted.
Okay, all right, and what that means is that with the Snelling's test, you stand 20 feet away and you try to read a line, and that measures your distant acuity. Then you would have the Rosenberg test, and that is where you have read the card, it's 14 inches away, and that measures your reading acuity. So next, I'm looking at your eyes. Your eyebrows have the same color hair. Your hair as the hair on top of your head. Your hair is evenly distributed. I'm looking at your eyelashes. Again, those are brown, evenly distributed. Next, I'm going to palpate. I'm going to feel on your eyes. And I'm looking at your lacrimal ducts. And those are not palpable. There's also no exodus noted. The next thing I'm going to do is I'm going to take the pen light here. And this thing stopped. When did it stop? We might have to start all over again.
It's still on there. You have 6 minutes.
But that thing, okay.
It just popped up, so just say restart.
Okay, all right. So the next we're looking at your eyes. We're going to test for perla, and this is done with the light pen. Your pupils would be equal, round, and reactive to light. Also follow the pen light. First look back here behind my shoulder, and then follow the pen light up. Pupils equal, round, reactive light, and accommodating. Then next I would take the ophthalmoscope. And if the room was darkened, I would first be able to see the red reflex, and that's redness that would shine back on the optic nerve. Then I'm going to get close to you and look inside your eye, and I would be able to see the optic disc, which is round, and I would follow that up nasally, and then back, and I would see the fundus in the back. And that would be a white color, and your arteries to veins are 2 to 3 back there. Next, for your eyes, we're going to do the cover and uncover test. So I want you to cover one eye. All right, and you just let me know what this is a bunny, and you let me know when you can see it. You ready?
Oh, I can see it.
Okay.
I can see it. See it.
Okay. All right, and keep on. Let me know when you can see it.
I can see it.
Good.
I can see it.
Okay, great. Next, I want you to follow the tip of my pen light. You can uncover your eyes. I want you to follow it in all the 6 cardinal directions. Okay, great. All right, so that's your eye exam. And that covered cranial nerve 2, 3, 4, and 6. Next, we're going to do number 5 and number 7. 5 is the trigeminal, 6 is the facial. So for the trigeminal nerve, I want you to know if you feel soft or hard.
Soft. Hard. Soft. Hard.
Great. All right, and next we're going to do some facial exercises. Can you smile? Can you frown? Puff out your cheeks. Keep your eyes closed and try to raise your eyebrows. Great, and that's cranial nerve number 7. Next, we're going to work on cranial nerve number 8. That is your auditory. So we're going to do a couple of tests here to test for the acuity there, and then we're going to do some inspection. So first, I'm going to place this on top of your head. I want you to tell me if you can hear this in one ear or both ears.
I can hear it
in both ears. Okay. Next, I'm going to place this behind your on the mastoid process behind your ear. I want you to tell me when you stop hearing it. Then I'm going to place it in front of your ear, and I want you to tell me then when you stop hearing it. The difference there should be 2 to 1. All right.
I don't hear it.
Okay.
I hear it.
Okay. Let me know when it stops.
Stop.
Okay. All right. Great. And again, that should be 2 to 1. Next, I'm going to look inside of your ear. And I'm looking at I'm inspecting the outside of your ear, and they are symmetrical. The top of your ear that lines up with the outer canthus of your eye. I'm going to palpate. Let me know if you have any tenderness. Any tenderness or pain? No, and there's no redness. And again, your ears are symmetrical. They're lined up. and there is no redness, no drainage noted. So now I'm going to look inside of your ear, and what I would be looking for is the tympanic membrane, and it should be gray, pearly gray with no bulges, and it is. Okay, the next cranial nerves that we're going to look at is number 9, 10, and 11. This is all going to be inside your mouth. So if you can open up your mouth, say ah. So I would look in there with the light, and I would see your uvula fall and raise. I'm also just looking outside your mouth. Your lips are pink and moist. The buccal mucosa inside is pink and moist. Your frenulum, can you go like this? Your frenulum at the top and the bottom, and lift over your tongue, is all intact. I would also be noting your Wortman's ducts there. Also, your teeth are nice and white. There's no caries there. With the uvula going up and down, that measures cranial nerve number 9 and number 10. Also, your tongue, can you stick out, wave from side to side, and that so that does your glossopharyngeal and hypoglossal. The next cranial nerve that we're looking at, this thing has done timed out on us again. The next cranial nerve that we're looking at is going to be cranial nerve number 12. That's a spinal accessory. Can you shrug your shoulders up? All right, and then put it out, and then try to do it against my resistance. Great. The next thing that I'm looking at is your neck area. Your neck is even and symmetrical. Can you swallow? Great. All right, and the trachea moves up and down symmetrically. The skin color, again, is the same skin color as your face. All right, now I'm going to stand behind you and make sure that this thing here can match up with what, can you see it? Let's see here. I want to test your, make sure it can see me. Okay, so now what I'm going to do is I'm going to try to palpate your neck here. So I'm going to have you turn here to this side, and then go ahead and swallow, and then turn here to the other side. Great. All right. Next, I'm going to check your lymph nodes here. I'll palpate for those, and your lymph nodes is going to be preauricular, postauricular, a supramandibular, mental up there, supraclavicular going down, and scapula here. And there are no lymph nodes, palpable. If they were, I would see if they were moving or anything like that. Next, we're going to, with your neck, I'm going to look at your breathing. So that's going to bring us down to the thoracic. Let me put this back over here to me. All right, so to your thoracic area. And I'm looking there. I don't see you using any accessory muscles with your breathing. The thoracic area appears to be the same color with just a few maculars noted there. There's one there on your neck that's freckle. And your breathing is even and distributed. Your shoulders are evenly and symmetric for your breathing. Next, I'm going to palpate the front and the back for the thoracic area. I want you to let me know if you have any pain or anything like that. So I'm going to come down here, and you're going to make sure this is on me, or scoot up in there. Okay, so now what I'm doing, I'm inspecting. There's no heaves, no lifts, no thrust. I'm going to palpate up here, and we're going. These are going to be evenly and on both sides. All right. So again, there's no lumps, bumps, bruises, anything like that. I'm going to have you say, when I put my hands down, I want you to say 99.
99. 99. 99.
Great. Okay. And what I'm checking for there is going to be the tactile fremitus there. Also, now I'm going to, if you can lean forward a little bit, I'm going to percuss here, both of these areas. And what I should hear over the lung sounds is resonance. And again, we do these bilaterally on both sides. When we get down to the excursion, I'm going to tell you to take a deep breath and exhale. All right, and then with that, my hands would move. To measure the excursion, I would palpate down until it goes from resonance down to dullness, and I would mark that area. Then coming up from the top, I would palpate till I hear dullness, and then when resonance begins, and that should be 2 to 3 inches there. And that would test for the thoracic expansion there, and the excursion. All right, next I'm going to listen to your lung sounds. And what I'm looking for is any adventitious sounds. If I hear any bronchi, wheezes, and I shouldn't hear any of those. So first I'm going to hear the tracheal right here, and then bronchioles beside it. And then again, we're comparing side to side. And then bronchiovesicular, bronchiovesicular, and vesicular, vesicular, vesicular. Those are your lung sounds. And again, I shouldn't hear any wheezes, any rocking, or crackles. The next part of the assessment I'm going to look at is going to be your heart. Again, I'm looking at your breathing. You're not using any accessory muscles. I would be able to palpate here the apical pulse, and this right here moved out again. I would be able to palpate your, and that's the point of maximum impulse. Also here too, while I'm looking at your neck, I didn't hear any bruits there when I was auscultating there. I can see your pulse there, and that's normal, within normal limits. So first I'm going to listen here to the second, on the right second intercostal space, that's the apical. The pulmonic is left, second intercostal space. Erb's point is third intercostal space. The tricuspid area is the fourth intercostal space, and then the mitral is going to be the fifth intercostal space, midclavicular midline. All right, so I'm going to listen to those. All right. So again, apical, pulmonic, Erb's point, mitral, and tricuspid area. All right, and your heart rate is regular. The regular beat is anywhere from 60 to 90. It would be less than 60. For someone who is more athletic would have a slower heartbeat. The next thing that I'm going to look at, I'm going to feel your pulses. So at this point, I'm going to ask you to lay down. All right, and let me get this here to come. All right, can it see you? Okay, yeah, it should be able to see me. Okay, so I'm going to, let me bring this here closer. Okay, so first I'm going to check your pulses. I'm going to check your temporal, your brachial, here, your radial, your popliteal is here, underneath here. Your dorsal pedalis is here on top of the foot, and then the the posterior tibial is here on the side. Can you see that? I think so. Okay, so those were your pulses. Next, I'm going to inspect your abdomen. So I'm just going to lift your shirt up just to right here. I have to lift your shirt up. And I'm looking at your stomach, and again, the color is the same as it matches the rest of your body. The color, you do have some stria there. You've had children before?
Yeah.
Yes, okay, and so stria is normal. This one to me. Stria is a normal finding in women that's had children. So again, I'm inspecting first. I'm looking at your umbilicus area. There's no bulges, no massing noted, and the umbilicus area looks round. The next thing that I'm going to do is, now that I've inspected, next I'm going to auscultate. I'm going to auscultate over your liver, your spleen, your iliacs, and your kidneys, and we are going to defer the femoral. All right, so listen here. All right, so I'm listening to your kidneys, your spleen, your iliacs. All right, and then also the aortic here. And again, what I'm listening for is any bruits heard, and there's no bruits, no frills in your back. Next, I'm going to auscultate all 4 quadrants of the abdomen, and I would listen for 1 minute on each quadrant, and I should hear sounds, 5 to 30 sounds in that 1 minute. All right, and your vowel sounds are present, no hyper or no hypo sounds. Next, I'm going to palpate. Next I'm going to percuss. Over the stomach, there should be tympany. Over the organs, there should be dullness. So there would be dullness here over the liver. Dullness on the intercostal margins over here for the spleen. And then tympany over the stomach. All right. And then next, I'm going to try to palpate the liver. The way that we palpate the liver, you're going to lay here, and I'm going to tell you to take a deep breath. And when you do, I'm going to palpate the liver. Go ahead, take a deep breath. All right. And then the normal findings of the liver is that it would be 4 to 12 centimeters, and that the edges would be smooth and round. Next, I would have you, again, take a deep breath in. The spleen is normally not palpable. This thing changed again. The spleen is normally not palpable until you breathe in, and with that, I should be able to feel it go up. The kidneys are generally not palpable, and they shouldn't be enlarged unless there's some type of like kidney disorder or something like that. So that's your abdomen area. Next, we're going to work on your range of motion. All right, so I'm going to have you lift your leg up, this leg up. This is flex, down, that's extend, out to me. That's abduction, and crossing your leg over there. No, this way here, just straight up, that's adduction. So now you're going to do that against resistance. Try to raise up, try to raise down, try to come to me, try to come to you. All right, great. Next, we're going to do internal rotation. You're going to cross your leg like a man. There you go. And then out. Can you cross your leg out? Out this way. Just turn it so that your knees are touching each other. And then this way here. All right, and that's external rotation. Next, we're going to work on your knees. All right, so I'm going to raise your head up and bend your knee up towards you. That's flex. And then out towards me, that's extend. So now we're going to try to do that against resistance. Try to raise your leg up and try to raise your leg back down. Great. All right. Next, we're going to work on your heels. We're going to do inversion and eversion. So point your heel towards your other heel. Turn his leg that way. And then, let's turn this so we can see. And then out right there, so that's internal and external rotation. Next, I want you to point your toes towards you, like up like that. That's dorsiflexion. Push it down towards my hand. That's plantar flexion. And then you're going to do that against resistance. Okay, and then try to push down. Perfect. Okay, so then the last thing, let me hold your hand and try to rotate. Just rotate your feet around in a circle. Perfect. All right. So next, you can stand up, and we're going to do some exercises. All right, can you see this here, right there? Okay. And the first thing I want you to do is step back, put your leg back. That's hyperflexion. Okay. So now we're going to first we're going to work on your neck. Can you see this right here? And I just want you to do what I do. First, you're going to forward. That's flex, regular. Have good regular. That's extend. And then back. That's hyperflex. So that was your neck. And then we're try to touch your ear to each shoulder. That's lateral. And then from side to side, that's rotation. So now you're going to try to do that against resistance. Try to move your head forward and then backward. Okay, and then against my hand, side to side, and then twist, turn to turn. Okay, All right, so that's your neck, your head, and your neck. And then next we're gonna work on your shoulders. So I want you to put your hands up like you're gonna dive. Put them down, and that's flex. Down to your side is extend, and then backward, that's hyperextension. Next, we're going to work on your elbows. So if you can take your hands, put them up like this, that's extend. Down like this, flex. And then this is supinate and pronate. All right, I want you to do also for your arms, I want you to go out, and then back down again, and then across your body like that, okay? So now you're going to try to do this against resistance, and push out. Push, okay. And push in. All right, push in. This way, here, come to me, And then try to push back. And then push forward. There you go, great. All right, so those were your shoulders. They're the shoulder joints and your elbow. All right, so now we're going to work on your wrist and your fingers. So for your wrist, go down. That's flex, extend is straight up, and then hyperextension. All right, next we're going to do your fingers. You're going to go down, midway, and then hyperextend. Also with your fingers, spread your fingers out, abduction and adduction. So now we're going to try to do these things against resistance. So try to push down, try to push up, try to open your fingers. All right. Then I want you to grip my fingers. No, like this right here. All right, I'm testing your grip. Your grip is strong and bilateral. Also, I want you. All right. Also, I want you to. We're going to test your We're going to test. I want you to touch each thumb to each finger, just like that. Okay, great, perfect. All right. So then the next thing we're going to do, I want you to bend down and touch your toes. We're testing your hip, and while you're doing that, I'm testing for scoliosis, lordosis, kyphosis. There's none of that. You can come back up, and then go back, hyperextend. All right, and then go from side to side, and then rotate. Perfect. All right, so then the next thing that we're going to do, I want you to, while you're sitting up here, I want to test your joints there. I don't feel any heat, any masses noted. I want you to go back there, and I want you to come back and go heel to toe. Can you see that right there? Heel to toe. All right, perfect. And then I want you to close your eyes, and I'm going to push you back. All right, come back, and that Romberg is positive. I want you to take your hands like this and go real fast. Supinate, pronate, perfect. And then take the heel of this foot and go down on your leg. Perfect. All right. You can go ahead and you can have a seat right back here. I want you to do like we're going to do a sobriety test. You're going to close your eyes and touch your nose with each, and then with the other one. Okay, perfect. Then I want you to cross your legs like a lady. All right, and that tests your quads and your glutes. All right, you can finish with that. All right, the next thing that we are going to look at is the mental aspect. So now I'm going to put something in your hand, and I want you to tell me what it is. Close your eyes. All right, and what is that? Can you feel what that is?
A penny.
Perfect. That's stenosis. And then I'm going to draw a number. Keep your eyes closed. I'm going to draw a number in your hand. It's this right here. Going. All right, and you tell me if you can see what number that is. Feel what number that is.
8.
Okay, perfect. All right, you can open up your eyes. Close your eyes one more time. I'm going to put this vibration on your joint, and you tell me if you can feel it or not. Do you feel that?
Yes.
Okay, great. And again, we would do this bilaterally. The next thing that I'm going to look at with your eyes closed again, I want you to tell me if you feel soft or dull, and then I want you to point to where it's at.
Soft.
All right, and can you point to it? And then,
Dull.
or sharp, okay, and point to it. All right, perfect. Then the next thing, Gavin, stop, buddy. And then the next thing I'm going to do, I want you to tell me if you feel 2 points or 1 point. You ready?
2 points.
Do you feel 2 points?
2 points.
All right, and then this one.
1 point.
Great. And now let's do, and that's within normal limits. So next I'm going to do this on your hand. Do you feel 2 points or 1 point?
2 points. 2 points. 1 point.
Perfect. All right. Next, I want to check your reflexes, and then we'll be finished. Gavin, please don't do that, buddy. So first, I'm going to raise up here. Did you feel that?
Yeah.
Okay. All right. So that's your tricuspid,
Yeah.
your brachial, radial, okay. And then for the patellar, in order to do that, I want you to take your hands like this. I'm going to tell you to pull, look that way, and pull, pull, pull. Did you feel that? Okay, good. So those are your reflexes. And so that completes our head to toe assessment. So do you have any questions for me?
No, I do
All
not.
right, thank you so much. All right, how do we stop this?